Little more than 2 days from the federal government essentially running out of money, the funding for this year. Chief Congressional Correspondent Mike Emanuel has the latest on what's being done to try to stop a Friday night shutdown.
We'll continue to be able to fund this government.
You know, we're awfully close. I mean, we would like to get it done this week.
We're within striking distance. There's still some outstanding issues that we have to deal with that are knotty.
Facing a Friday midnight deadline, lawmakers continue negotiating, trying to strike a deal to fund the government through September. But with the expectation that Democrat votes will be needed in the House and Senate, their leaders see an opportunity.
They'll need our input, and that's where Democrats, for lack of a better term, we have leverage.
Democrats agreed to providing $15 billion more in defense spending, but wanted the package to include ObamaCare insurer subsidies, what Republicans call a poison pill.
We're not doing that. That is not in an appropriation bill. That's something separate that the administration does.
Last night, lawmakers unveiled an amendment from New Jersey moderate Tom MacArthur and conservative Freedom Caucus Chairman Mark Meadows. When asked by Fox if it had the votes to pass the House, Ryan expressed support.
We want to give the states the ability to kind of customize the reforms to maximize the ability to lower premiums and protect people with pre-existing conditions, and that is exactly at the heart of what the MacArthur Amendment does, and I think it helps us get to consensus.
The Freedom Caucus backed the plan, saying, quote, while the revised version still does not fully repeal Obamacare, we are prepared to support it to keep our promise to the American people to lower health care costs. But the concern for GOP leadership is winning over conservatives could lose moderates who are also needed to pass the bill.
My concern about what was going to happen with seniors, allowing insurance companies to charge seniors 5 times as much as a young healthy person rather than 3 times as much as the law is now, wasn't addressed in any of these.
Some Democrats are suggesting changes to health care reform won't fit Senate reconciliation rules, allowing you to pass it with a simple majority, and they suggest it would take 60 votes to pass in the Senate. The more immediate battle is passing it through the House, which sources suggest could come next week. Brett?
Mike Emanuel, live on the Hill. Mike, thanks.